Today we'll be reacting to Warning New South Wales COVID-19 outbreak has hit its peak. Coronavirus 9 News Australia. Let's get into it.
Good evening. 633 new cases, a surge of more than 180 in just 24 hours.
Today.
And a warning,
wow.
We haven't seen the worst of it. Sydney's COVID horror reached a frightening new level today, but our level of hope also jumped. Vaccination clinics at Macquarie Fields, Homebush, Bankstown and Brighton-Le Sands overrun by people rolling up their sleeves. Queues for hours, but worth the wait. Eddie Meyer begins our coverage.
All the coverage.
It is by every measure now a state of despair, a crisis growing by the day, a challenge on a confronting scale.
Health Minister.
I can't express enough my level of concern at these rising numbers of cases.
Of the 633 cases identified today, up to 539 people may have been infectious in the community for some or all of the time. And in this current outbreak, each infectious person is passing COVID-19 on to an average of 1.3 people.
For us to know that we've reached our peak, that can't continue. So what the data is telling us in the last few days is that we haven't seen the worst of it.
As cases have risen, so too have hospitalisations, now up to 462. The number in intensive care has risen to 77. 25 people need ventilators to breathe.
And we know that for every one of those individuals in ICU, particularly those in the older age groups, they have a real and material risk of death.
And sadly, there were 3 more deaths, a man in his 60s and 2 in their 70s.
We will see more admissions and more deaths if these numbers continue to increase.
They increase.
We have a collective responsibility to do all we can to stop seeing those deaths.
The ADF has already started to settle into one of our key hotspots, Bankstown, ready to help. Important because of today's cases, the majority, 550, are still from Western and Southwestern Sydney.
Marylands, Guildford, Auburn, Greenacre, Yagoona, St Mary's and Strathfield. And these are the suburbs of most concern where we're continuing to see an escalation of cases.
But with 736 penalties issued yesterday, it's clear some are determined to continue breaching the public health orders, leading to this plea yet again.
Some of the stories we hear every day about the way people are suffering, the way people are seeing loved ones die, and the impact it's having is just devastating. So just stay home. Don't try and look for loopholes. You know the intent. Please minimise your movements. Stay at home. You cannot get the virus if you do not have contact with other people.
But again today, questions. Has Dr. Chant given the government advice on lockdown restrictions? It's simply ignored.
It's a yes/no answer.
No, it's not it's not as easy as that. What we do is define the problems. We define the